Coming up next, it is the Pulse Radio Show right here on Q, and it is brought to you with the compliments of MedSafe Medical Supplies Limited.
Good morning and welcome to another edition of the Pulse Radio Show, a production of the Queen Elizabeth Hospital in collaboration with our friends here at the CBC. I'm your host, Shane Seeley, Communications Specialist with the QEH. Of course, we got to salute our sponsors, MedSafe Medical Supplies, for always making this happen. You can find them there not too far away from the hospital, and they make sure that you have all your medical equipment and other needs provided. We'll be talking a lot more about them too, making sure that you know how to access their services, and we must always thank them for supporting this program, the Pulse Radio Show. It's good to have you back with us. Of course, you know those numbers to call: 434-1007, 434-1070, and 434-1007. And we have a great show lined up for you as usual. You know, over the past few weeks we've been talking about all that is the 2025 to 2028 strategy, the new strategy for the hospital. So let me first announce that very soon, on the 4th of December to be precise, we will be having what is our public QEH Town Hall. This is a public forum open to everyone, all of those interested in what we will be doing over the next 3 years to enhance care across the board at the Queen Elizabeth Hospital. We're asking you to come into our doors and come to our main auditorium at 6 p.m. on that Wednesday, December the 4th, to share your point of view, to have your say on what the strategy looks like, what you think about it, and also give your input. This will allow our CEO and the executive directors to give shape to what the final product will be, the final strategy for 2025 to 2028. Right now it is still in draft. The CEO, Mr. Neil Clark, is pushing to finalize that strategy so that as soon as we hit January 1st, really January 3rd, of course there's some bank holidays to come, that we will be moving in that direction to start this strategy wholesale, where you will see those improvements from January. So we've been talking a lot about the new CT scanner coming into the accident and emergency department. We've been talking about a number of advancements to really speed up the level of care, address those waiting times that people sometimes complain about, and other issues. And you know you can always come here right on the Pulse Radio Show to air those complaints so that we can hear the concerns and get a response for you by either we give you it here with our specialists on the team, or we can have you call our hotline at 536-4800. That's our patient advice and liaison service. We got you, of course. We have to get those compliments which you have been sharing with us week after week, and we thank you for that. But as the CEO always says, we can't improve the service without your feedback. Your feedback is critical, and that's why we have given you this outlet on the Pulse Radio Show. Cardiology is something that is a specialty. We have many specialists at the QEH in cardiology, and they've been working hard to handle the increasing numbers coming into our cardiac unit, and of course a number of them have been coming for other procedures, and there's some big enhancements that have been happening already. So the next 3 years really looking bright as far as cardiac care, the QEH showing love to cardiac patients and really the cardiac population, which continues to increase in terms of the issues that they're having. That's why we had to have on this program today Dr. Dawn Scantlebury. She's a consultant. She's the head of the Cardiac Services at the Queen Elizabeth Hospital. Dr. Scantlebury, great to talk to you again. A few months ago, earlier in the year, we were really focusing on cardiac care during crop over.
During crop over.
Yeah,
Yes.
when we know that things, people have fun, but sometimes they can have too much fun, and that leads them to you to find answers.
Yeah.
So we really want to start there. Talk about the cardiac issues, the cardiac problems. We know cardiovascular disease is one of those chronic non-communicable diseases that really impacts our population. We've been hearing about more people suffering heart attacks, more people suffering other issues related to the heart. And I know you and your team have been showing our patients a lot of love and trying to point them in the right direction. So paint that picture about the state of cardiac care and cardiac issues within our population.
Okay. So, yes, cardiovascular disease is one of those chronic non-communicable diseases, as you term it, but it's actually the number one cause of death worldwide, the number one cause of death and disability in Barbados, number one cause of premature death as well. So what people tend to focus on the hypertension and the diabetes and the cancer, not realizing that the diabetes and hypertension, there's one final common pathway, and that's through the heart. That's through the brain and the vasculature. The brain, the vasculature, and the heart, all cardiovascular disease. So the likelihood of your dying from a heart attack, stroke, heart failure, all of that is higher than the likelihood of your dying from all cancers combined. The likelihood of just a woman dying from heart failure, heart attack, stroke is significantly higher than all cancers combined.
Wow.
Never mind breast cancer. There's a concept, people have this concept that breast cancer is the main issue that women may have, but no, it's going to be cardiovascular disease. And the unfortunate thing is that even though we have known this for decades, so this is not a new thing. Cardiovascular disease has been the number one cause of death for decades and the number one cause of premature death. It continues to rise. So all our efforts seem to be for naught because the numbers are rising and the percentage of people are dying are rising. A lot of that has to do with our lifestyle. So when we had our conversation over crop over, we were talking about the impact of our culture, not only on things at crop over, but our culture in a negative way. How our lack of exercise or a high caloric diet leads to an increase in hypertension and diabetes, and that subsequently leads to an increase in cardiovascular disease, diabetic foot disease, stroke, heart attacks, heart failure. So one of the reasons why it has become so important to focus on cardiology, and I should say the Department of Cardiovascular Services, because that department encompasses not just medical cardiology, but also invasive cardiology and cardiac surgery, both at the adult and the pediatric level. So we have a fairly all-encompassing department looking at all aspects of cardiovascular care. And it's vitally important to focus on the department because it's the number one cause of hospital admission, number one cause of death.
I want you to share with Barbadians, you touched on it a bit, but I want you to put this in perspective. What about our lifestyle is leading to this significant increase in people coming with cardiac issues, and you're seeing it also translate into the numbers coming in to our clinic? And I'm going to get into the clinic because, as I said, this 2025 to 2028 strategy speaks to some of the improvements in terms of the workforce that are coming in cardiology and also in terms of equipment. So that's the good news. But I want to speak to what are we doing wrong as a population?
50, 75, 100 years ago, we were an agricultural based society. We ate a lot, because we had to burn out the calories in the fields. Now we still eat a lot, but everybody's getting in their car and going to their desk job or their teaching job or their this job or their that job. But they're still eating the high carb meals, and unfortunately, somehow we've gone over. We've moved from that plant-based, non-processed food lifestyle to heavily processed food. So everybody thinks of macaroni and pie now as our national dish. It's no longer cuckoo and flying fish.
I always tell people, Dr. Scantlebury, it tastes good. I know that, but you're not going to see me eating macaroni pie. Mm-hmm. Not even once a month. Mm-hmm. Not even, and that's just me. I have tried to move away from that acquired taste.
Right. But
I know it can be difficult. It's like a drug.
It's like a drug. It's the salt in it, the fat in it, the carbs. So it's a slab of macaroni pie is a whole meal, but people don't treat it as that. It's just a side. So then they go and put the sliver of lettuce and a big piece of meat, and then maybe another side on it. So
don't forget the sweet potato pie and the rice.
Oh, that is true.
And we are coming to Christmas.
Right. So you've ended up with a meal that's probably 1,000, 1,200, 1,500 calories for a single meal. And that's how much the person who's sitting at their desk should be eating for that meat for the day. And then they put in all the other stuff. So that leads to an increase in body mass index, increase in your waist circumference, which leads to an increase in all these hormones that lead you to have high blood pressure, diabetes. Diabetes, unfortunately, accelerates cardiovascular disease, accelerates heart attacks and diabetic foot disease, which is a cardiovascular disease as well. It's the blood vessels in the feet don't work.
So it seems like all the NCDs are linked directly to
heart attacks and stroke.
Heart attacks and stroke.
Yeah, they all are. Even cancer or lifestyle leads to an increase in lots of different cancers. So the same kind of negative habits that lead to an increase in cardiovascular disease can lead to an increase in cancer being developed. And as we improve our cancer care, some of those cancer treatments can then lead to an increase in cardiac disease as well. There's a whole specialty of cardiology called cardio-oncology, which leads with the effects of cancers and the effects of cancer treatments on the heart. So unfortunately, the poor little heart gets left behind because everybody thinks that, it's a disease of of old people, so it'll come to you anyway. But remember, I said it's the number one cause of premature death. So we're seeing young people, we're seeing children, mostly congenital, but a lot of these lifestyle diseases, lifestyle changes, lifestyle related cardiac diseases, so atherosclerosis, which is cholesterol plaque being laid down in blood vessels, we're seeing it in progressively younger people. So that Graham Round's presentation that we have at noon today is talking about heart attacks in young people. We're talking about 20s and 30s.
20s and 30s.
Yes.
So I know that you'll share some more information because you mentioned what I would consider portion sizes that we need to control. Instead of having those 1,200 calorie one meals, we can break that down into a number of meals, and we need to include exercise and then hydration into that as well. You're the doctor, so you'll be given that advice as we go down this program. We do have a caller on the line, so let's go to the phone lines very quickly. We have a lot to digest in this program right here as we try to help Barbadians fight cardiovascular disease. And we are still to get to what you are seeing in clinic, Dr. Scantlebury, because I want you to paint that picture, because this is the information that our public needs. We need to get our act together. We need to take personal responsibility. While it is the responsibility of the Queen Elizabeth Hospital to take care of you when you are in a state of, emergency, when you are suffering from cardiac illness, cardiac disease, you have a responsibility to combat that as well through your diet, through exercise, and through a healthier lifestyle. Let's go to the phone lines now. Welcome our first caller. Welcome to the Pulse Radio Show this morning. We're focusing on cardiology in a big way. What's your question or comment?
May pleasure and palaces though we may roam, be ever so humble, there's no place like home. A charm from the skies seems to have us there, which seek through the world, is near met elsewhere. Home, home, sweet, sweet home. There's no place like home. There's no place like home. Peace be on each and every one. A blessing and a spirit-filled week. I salute you, Dr. Scantlebury. Shane, good morning to you.
Good morning.
I'm back home in my beautiful country.
You were calling us from overseas all the time.
Yes.
Well, I'm glad that you don't have to make those expensive calls.
I don't mind. Once I talking to, especially Dr. Ford, I don't mind wasting it. I don't mind. It was very good, and I'm glad that you all came up with this program. Dr. Scantlebury, my family, my relatives are cancer and heart failure. I had a very close relative who had triple bypass, and the other one had triple bypass. So I know about that, and I thank you all, for doing a good job at the hospital, especially when it comes to surgeries, where heart is concerned, and cancer. What I would like to see, Sean, I don't know. There's families who I would like to see that you will be able, different visiting time, to come in to help assist your relatives, especially those ones who cannot help themselves, like feeding, and help. I feel that if y'all should, who willing to come, give them a chance to come and help out. That's what my feeling is.
It's a good suggestion. It's a good suggestion, and it is one. It is a suggestion that I would like you to bring to our town hall coming up. We have that public forum coming up on the 4th of December in our main auditorium, and it is all of these suggestions that we really want to hear. Our CEO wants to get wind of, so that we can find some way to implement them into our strategic plan for better care and better delivery of service to our patients. So if it is that we can find a way, working with those individuals who want to come in and help our nurses and help our team on the wards, maybe it's something that can be looked at holistically, and let's find a plan, a proper plan, a scheduled plan where that can happen. Because you know what? That is a part of philanthropy as well. You giving back to the hospital and you giving back to your country. And it's timely as we celebrate independence, because I think this is a message that we want to preach across the board. Barbadians helping Barbadians, and we're gathering next year. So as we gather next year, the Prime Minister has called 2025, we're gathering again. So let's gather again and help one another. So if this is another way and another proposal that can go in that direction, definitely we would welcome it, and we would want to hear it at that public town hall Wednesday, December 4th. So you make sure you come then and share that, please.
Hello? Yeah, I won't be able to come because of transportation of where I live.
Don't worry, we're working on something that we could live stream, so that you can stay home in the comfort of your home, like how you calling us now.
That is very good.
Yeah.
But why I say this too is sometimes when the breakfast and thing come, some of the sick persons, the servers come back and take it up and they use it because they can't afford to use it, and they need somebody to help feed them. So
agreed.
And I would like, if my family and they, or even myself, that my relatives could come and assist me if I'm not able to help myself, and that is what I can do if any of my relatives go to the hospital. Once the doctor who in charge of the ward could allow me to come, that is what I would like to do. So I hope that will be something put in place, that some relatives who are at home could come down and help assist looking after their loved ones.
And you know what? I was going to say, what I like about this is that, you're not complaining. You're not saying that when people come to the hospital, they don't have the chance to feed their relatives, or that it is a situation where our nurses are not doing the job, so the family has to come and feed. You are offering a suggestion, and that's what we want.
But I had
those suggestions coming to us so that we can make it happen, because it all speaks to improving the service.
When my mom
100%.
when my mom was there, yeah, they had no problem. We made sure that everything was. All they had to do is to just give her medication, because she was our mama. We wanted her to be comfortable. So I always said that, and I'm glad that you are bringing up that. And don't think that, yes, we sometimes you go and you get rough times and things, but at least, I stay glad that you could come and you be able to come and speak and make suggestions. So I hope that the board and everybody would listen to my humble plea. And I know that I have a lot of relatives that were glad to go and assist their families. So
yeah, I want to hear it again come the 4th. So you make sure we're going to send out that information to tell people how they can connect virtually. So we're going to make that happen for you. We want to hear it again. I'm sure our board members will be attending as well, so they will want to hear firsthand. And I really want to thank you for sharing that suggestion with us here today on the Pulse Radio Show. Dr. Scantlebury, you wanted to add anything to that?
No, I thought that was a good suggestion, actually. Pretty good suggestion. So,
thank you very much. Yeah, thank you very much for sharing with us, caller. Okay. You see, and again, that's what we're about. Suggestions to improve the service. So getting back to Dr. Scantlebury, and before we get to that, let me just give some quick notices as well, because a number of things happening at the hospital as we continue to improve the plant as well. We have a stairwell renovation project, and you can go to our website www.qehconnect.com. And for those, you got granny that may not be so au fait with the technology, help her and show her how she can get on QEHconnect.com so she can see that we are having some stairwell renovations happening. They're starting from today and they will be happening over the next 3 to 4 months. Another effort to improve the plant, and we will identify those stairwells which will be out of service as you traverse the hospital, because we want you to know how best to make your way from outpatient clinic to pharmacy to wherever you need to go in the hospital. But also something a bit more urgent, there are some parking restrictions, especially for those coming to the physiotherapy clinic. The physiotherapy is to the rear entrance of the hospital. You come in the rear entrance and make your way along the driveway. You will see security there. They'll be telling you, it's only about dropping off today. You can only drop off those patients who will need to present themselves to the physiotherapy department, because we have some major movement of some other equipment coming in through that direction. So please observe, for those of you going to physiotherapy, observe the directions from security. They will guide you and help you to, really get what you need to get when you come at our hospital. Speaking about the clinical settings, let's go into your clinic, Dr. Scantlebury. Tell us what you've been seeing in terms of the trends, in terms of the flow, and how you're coping. We know some new staff are supposed to come on board under the new strategy as well. So let's paint the picture first with what's happening in the clinic, and then get to the better news in terms of what's to come.
So our clinics are huge. They're quite large, and I think part of it, of course, is the press of the disease burden, coupled with the fact that that disease burden has kind of outstripped the staff complement. So when I was a medical student 20-something years ago, there were 4 cardiologists on staff. And I used to hear when somebody came in with a STEMI, it was a big deal. A STEMI is a SC segment elevation myocardial infarction. That is a big heart attack, and that was rare. This month some days we've had 2 or 3 of those in a day.
So before it was once or what?
Once a month.
Once a month?
Really, it may have been a little bit more often. We didn't diagnose it as often, but it was not that often. So once.
And now 2 to 3 a week?
2 to 3 a day sometimes. So we have we have the Barbados National Registry, and that in 2020 or 2021, the last set of data we had 547 myocardial infarctions. It's probably 150 to 200 STEMIs, which are the big ones. So there'll be some weeks you'll have nothing, and then some weeks you'll have a couple, and then some weeks you have a lot. But this never used to happen. When I was an internal medicine resident, if I had a STEMI, I would have a STEMI like every few calls. That's every 4 days. Now it is a lot. My last on call, we had 8 heart failure admissions, and in one day. So this is the disease. It has been exponential as far as how much cardiovascular disease. And then of course there are the strokes. Those don't necessarily get referred to me off the bat. It depends on if they have a cardiac issue on the line, but we have a lot of strokes as well. So we've had these 4 cardiologists on staff, and we now have 4 cardiologists on staff, 4 adult cardiologists, 1 pediatric cardiologist, to deal with this exponential rise. So what happens is that you have this backup. It's backup in the clinic, you have the backup of testing, the backup of diagnostics. Waiting lists have lengthened. It's an 8-month waiting list for an echocardiogram, another 4 months for a stress test, another a couple of months for Holter. So all of these different tests that we do, that really and truly some of them should be urgent, but there's nothing called urgent when there are 100 people waiting for a very small proportion of the slots.
Yeah.
And unfortunately, people get irate with us when they get this appointment out to this time, but we can't do any better because that disease burden has outstripped our capability of doing the work. So what has happened over the last few years is that we've looked at the disease burden. We looked at trying to figure out what kind of staffing we need to deal with it. Obviously, we can't hire all the staff that we would need to deal with it in a first world manner, but the government of Barbados and the hospital have been trying their best to at least increase that staff complement so that some of those waiting times would decrease. So we hope that we're now that those staff or that staff has been approved and they're now being promised and they're coming into the pipeline. We're now coming up with the strategy to figure out how to adequately deploy that staff, because obviously we were going from 0 or 1 or 2 to more. And not just as far as cardiologists, but junior doctors, technical staff, nursing staff, etc. Those are, one man can't operate in a vacuum. It has to be an entire team. So we now have to look at how to use that team and how to go from the small physical plant that we have and how to best use that. I know we were talking before we started about perhaps having our own building, etc. That would be ideal, but that's not what we have right now. So we have to now be a little bit imaginative with the small space that we have to figure out.
I'll say this to you, Dr. Scantlebury, philanthropy has been good to the Queen Elizabeth Hospital this year, and if we have to go in that direction to meet the demand, I'm pretty sure that is something that can be put into the strategy. Yeah, we need to put it out there.
We need a cardiovascular center.
We need to respond to those demands that you're speaking about, the increasing burden on healthcare as far as cardiovascular disease is concerned on the hospital in terms of the clinic. But we're stepping in the right direction with more staff, more clinical staff to respond to that demand. We need more space as well. And I want you to shout out the team when we come back from this break. Also, when we come back from this break, more notices and a big procedure that was done by Dr. Scantlebury in collaboration with the Chinese medical team, the 7th team that has been here on the ground. So some groundbreaking work being done in cardiology as we speak, even before we get into the strategy, and more will be coming along with that equipment. So we got a lot still to talk about, as well as getting into the TCCP program. We'll tell you what that acronym means right after this commercial break.
For all your medical supply needs, visit MedSafe Medical Supplies Limited. We offer a wide range of products including wheelchairs, walkers, canes, crutches, blood pressure machines, stethoscopes, and so much more. Conveniently located on Gemmett's Lane, just a 2-minute walk from the Queen Elizabeth Hospital. And for your convenience, we deliver free to the QEH. Open Monday to Saturday, 8:30 a.m. to 5:30 p.m. Call us at 624-7542. MedSafe Medical Supplies Limited, your trusted source for medical essentials.
You're here with us on the Pulse Radio Show. I'm Shane Seeley, Communications Specialist for the Queen Elizabeth Hospital, alongside Dr. Dawn Scantlebury. She is the head of cardiology at the Queen Elizabeth Hospital, a consultant, a doctor who's been working hard to meet the growing demand of patients seeking those services at the Queen Elizabeth Hospital. You heard her paint that picture, and we're going to get into a lot more of what her and her team does. I got to shout out fellow Convemarian Dr. Christina Powlett, who is also with the team, and then she will shout out the rest. I know Dr. Powlett because she was in class with me. So when I see her in the hospital, walking around, it makes me feel so proud to know, that one of my classmates is also a part of this journey in terms of trying to make a turnaround, because we're going to make a turnaround in terms of the trend. It may not be hard, the trajectory, because I've seen some statistics suggesting that it will only get worse
as the population ages.
Before it gets better. But we have to be more responsible in terms of our diet and healthy lifestyle. Another notice for you, and this one coming from our blood collecting center. I want to say a pleasant good morning to our Wendy Lord, always doing great work making sure that our blood stocks and our blood supply is in good order, and that's because of you, those of you who come into the blood collecting department to donate. Donation. Again, we always hear it. It's not only about financial donation, equipment donation, but that blood helps to save lives. But the blood collecting center is closed today due to some cleaning over the weekend. So that cleaning continues, but the blood collecting center will be opened tomorrow at 8 a.m. sharp. So on Tuesday, 26 November, 8 a.m., the blood collecting center will resume operations. So just please note that it is closed today after some cleaning over the weekend, but it will reopen tomorrow. Just a note for those of you going to the blood collecting center to make your donations. You can do that from 8 a.m. tomorrow. Remember, I was mentioning the acronym TCCP. I added in an extra C there. So let me go again. TCCP, Transitional Community Care Programme. And one of our team members here is going to spend some time with us just to tell you a bit about it. Allan Worrell. Allan is the Assistant Program Manager with TCCP. He'll tell you what it's all about, the benefits of the program, some of the services offered, and how persons can enroll into the program, as the QEH is also in the community as well. So good to have you on, Allan, for our highlight for today's show. Talk to us about the TCCP program. What is it all about?
Yes, good morning, Shane. Good morning, Dr. Scantlebury and team. So Transitional Community Care is basically the coordination and the continuation of care post-discharge from the hospital. The program would have started in October 15, 2020. This was during the pandemic, and with the focus on chronic non-communicable diseases, specifically those patients who were non-compliant with their medication, visit, or have various social challenges which impacted their care. Ultimately, what occurred is that after the team would have been trained, they deployed, they would have enrolled a number of patients and liaised with specialists such like Dr. Scantlebury, specifically those on the medicine team, for the past 4 years in terms of coordinating care, helping those patients navigate the healthcare system. Because most patients believe that once you're discharged, you're on your own. So the program was developed to help those patients post-discharge to navigate the healthcare system to get the help that they need.
Nice. So when we reach out in this fashion to help those people in the community, as you said, post-discharge, they go back home, and we hear these stories all of the time. You know, they take the medication, they feel better, so they decide on their own they're going to stop taking the medication, which is not the advice of their physician, their medical doctor. Talk a bit about those benefits of the program. Helping them to stay on track, I believe, is one.
So there are many categories of patients, as you rightly said just now. There are some patients who, as soon as they feel better, they stop taking the medications, they go about their business as usual, and then something happens. They end up back in the accident emergency, and then they take up another bed for a protracted period of time once they're admitted. So part of the continuation of care is one of the things we focus on is medication adherence. So we frequently visit the patient, encourage them to take their medication. For the persons who are living with diabetes, hypertension, or heart disease, those ones that will be on medication for many years, what we do is that we liaise with their physicians, because sometimes as time goes on, or due to the unavailability of some medications, they might have to get 2 or 3 tablets, which would have substituted previously by 1 tablet. So we work with the physicians to try to minimize or find combination drugs for these patients so that they do not become too psychologically fatigued in the long term, so that they can have some quality of life.
Talk a bit about the team. Talk a bit about the team that you work with out in the community. How many people are we talking about? Those nurses and the medical staff who get out into the community to help Barbadians with their issues.
Right. So right now we currently have 2 physicians, 2 family med physicians, 1 diabetes specialist, as you know, nursing off the night, myself, the public health nurse, 1 social worker, and we have 31 community health workers. And what we've done operationally is basically divide the island, or divide the workload, and strategize based on our deployment so that we can effectively manage the patient load that we currently have. We are actually in the process of discharging some of the patients who would have met the criteria, who are following up with the clinic, following up with their primary care physicians, going back into the primary care setting for continuous management, and they're doing well. So there are benefits to following the discharge plan from their physicians in the hospital, and once they meet that recommendation, once they follow everything, we then discharge them back directly to their respective physicians.
Okay, so I know many people are out there listening to you, Allan, wanting to know how they can be a part. We discharge many patients daily, and they may not have the understanding of what to do next outside of what the physician tells them. This TCC program offers them that shoulder to lean on, that assistance that they can get, especially if they are compromised, disabled, etc. How can persons enroll into the program?
Right. So upon discharge, they can speak to their nurse on the wards. They can ask their physicians, because both nurses and physicians have access to the link for referral. If not, they can call through the switchboard through our patient referral system, and if they don't get through to that, they can ask the operator to send the call directly over to us, and we will take the information and follow up as necessary.
Yes, and that PBX you can call is 436-6450, and you can also call our patient advice and liaison service at 536-4800. They will be able to give you some direction to Allan and the team in terms of being a part of the Transitional Community Care Programme. Quickly, if you could mention the services offered. Just run through those services for me, please.
Right. So the services we currently offer, as I said, is medication, compliance, and adherence assessment. We've now started doing phlebotomy for some of our patients. Next year, we plan to expand the services to better support the entire hospital. So we are going to be looking to do some wound care in the community or for our patients post discharge, so that we can reduce the patients coming back to us on a daily basis. We do environmental assessments, social assessments. As I said, we have a social worker who also follows up with the patients to ensure that the economic or financial situation does not prohibit the patient from coming back to access care if they need to come back to the hospital. So these services are long, expensive. So basically, outside of the surgical services, we provide the same services the hospital provides, just in a community setting.
Well, listen, Allan, continue the good work. I really want to thank you for sharing. Of course, we will share more definitely about the TCCP program as we go into 2025. I'm expecting an enhancement of services from TCCP under the new 2025 to 2028 strategy. Allan, thank you for sharing and thank you for spending some time with us on the Pulse Radio Show. Our community will be seeing more of you and your team in the very, very near future, and I'm pretty sure we may see some enhancements in that workforce as well to get into more communities and assist more people who we discharge. Thanks a lot, Allan.
Definitely. Thank you for having me.
Okay, we're going to take another quick commercial break and then back with Dr. Scantlebury as we get into some of these special medical procedures that the hospital is doing, and just giving you the 411 on cardiology, cardiovascular care, and what the hospital will be doing over the next 3 years under the new strategy in the cardiology department.
For all your medical supply needs, visit MedSafe Medical Supplies Limited. We offer a wide range of products including wheelchairs, walkers, canes, crutches, blood pressure machines, stethoscopes, and so much more. Conveniently located on Gemmett's Lane, just a 2-minute walk from the Queen Elizabeth Hospital. And for your convenience, we deliver free to the QEH. Open Monday to Saturday, 8:30 a.m. to 5:30 p.m. Call us at 624-7542. MedSafe Medical Supplies Limited, your trusted source for medical essentials.
Thank you for staying with us here on the Pulse Radio Show. I'm with Dr. Dawn Scantlebury, our head cardiologist, the head of the department at the hospital, and lead in many fields in terms of invasive, or I should say cardiovascular intervention. So, before you get to that, I can let you get to that yet. Hold on, because we have a WhatsApp coming in. Person says, I wanted to send kudos to Dr. Scantlebury and her team in the cardiac unit. I think the entire team in the unit is a great team. They work so well together. That's my contribution. My favorite is Malcolm Cumberbatch.
Malcolm is our ECG technician. He's been with us for many years, actually.
Okay.
Very pleasant, very sometimes people come just to see Malcolm.
and we've had a situation that I saw this this lady came in and she was looking for one of the people on the medication delivery service, and we have a notice about that as well, the medication delivery service. And she just came to offer her appreciation in the form of a gift, just thanking him for his pleasant manner in dealing with her on the phone.
Yeah, and people appreciate that. Just
we just want more of these experiences across the board. I know there are experiences on the other side, but we are working to get holistically that kind of response from the Barbadian public. We want you to feel special, and we want to treat you how you deserve to be treated when you come in to the Queen Elizabeth Hospital. A quick note from the medication delivery service that will come shortly as we get into Christmas. We know people get very busy. Also, our delivery service gets very busy, so we will tell you what the operation would be like coming on to the end of today's edition of the Pulse Radio Show, so you can listen out for that, and how we will be delivering your medication over the Christmas period. Let's look at some of these special things that you have been doing with some assistance from the Chinese medical team. They have been a big help in terms of enhancing the overall platform of services offered at the QEH in a number of specialties, and cardiology is just one that has been the beneficiary. So talk about that work with the Chinese medical team and some of those special invasive treatments that you have been doing.
Okay, so I'll start off by describing what is I guess angioplasty is what a lot of people know it by a percutaneous coronary intervention. So years gone by, people knew about bypass surgery, and you have your 3-vessel bypass, and that's all we could offer. Back in 2016, we started our percutaneous coronary intervention program, where for patients coming in with heart attacks or who have...
I think you may need to repeat that again. Percutaneous...
Coronary. So the coronaries are the blood vessels of the heart that supply oxygen, and intervention, where we actually do a procedure. So it's
percutaneous coronary intervention. I like PCI. To get the people who are familiar with these terminologies, so that when they come and they mention it, they can say that they heard it from Dr. Scantlebury, because we're all about education here.
Right. So other people know it as angioplasty, and you may have heard of a stent, which is a little metal tube that we put into the blood vessel at the same time. So that's an alternative to surgery in some patients. Not everybody will be a candidate for that. Some people do need surgery. So when I consult my patients before we do the procedures, I say, okay, I'm going to take a look at your blood vessels. You may either just need medicine, we may be able to do a stent, angioplasty or PCI and stenting, or if the disease is extensive, you may need to go to bypass surgery. Unfortunately, in some instances, bypass surgery is not a procedure that we can offer some patients, because they're very high risk, their heart function is poor, they have prohibitive risk for surgery, meaning the surgeon turns them down because they think that they'll die on their table and they don't do well. So over the years, since that program was set up in 2016, so I did my first intervention in February 2016 at the hospital. So our first patient still comes by periodically to say hi, and we have done probably about 40 to 50 cases a year, but our complexity has been relatively low because of multiple issues, the physical plant, engineering issues, procurement issues. There are a lot of things that play into making sure that this program turns over and we do enough cases to keep those skills up. So what we've been doing is sticking to relatively straightforward procedures. There are just some very complex procedures that we just can't offer patients, mainly because if you're not doing it on a regular basis, you really shouldn't get into doing very complex things. So the Chinese medical team has assisted with that over the years, assisted with different areas of cardiology. They come into different areas of the hospital, as you had said. A few years back, at the beginning of COVID, there was this one particular interventionalist and electrophysiologist who helped quite a bit. He helped do other electrophysiology procedures, which is another thing that we could talk about. And then this team has another interventionist on it. So, and about a month ago, this patient came in who had had a heart attack. Her heart function was quite poor. She had exceedingly complex disease. Referred her to the surgeon. She was unfortunately turned down by the surgeon because of just how high risk she was. And because Dr. Deng had just started at QEH as part of the Chinese medical team, we were able to discuss it, and he was able to say, we can do this. You know, it's because he's a complex interventionist.
Nice.
And so when you work in a center such as he does, where that's what he does day in and day out, from morning to night, he's in the cath lab doing these procedures. There are certain types of procedures that they learn to do and are able to do. And, you know, unfortunately, I would have trained in that stuff, but because you don't keep up your skills, it's best that I don't do it myself. You know, you understand? So we were able to do this procedure. Essentially, it was what we call a left main PCI, where it's the main vessel on the left side was almost completely blocked off. And we were able to do this complex high-risk PCI here at the Queen Elizabeth Hospital. And, you know, even though our range of supplies is not that great, because he is so practiced and so expert at doing this, he was able to use what we had to get through, and it was completely successful. She's an extremely happy camper. Went home a few days later. I saw her back in clinic. She's doing very well, and this is someone that would have been too high risk for surgery. So our experience of the Chinese medical team, as far as the skills that they bring to our department and to our, I guess, the hospital has only been positive. Going forward, I'm hoping that we'll be able to keep up this level of complexity, because then I will learn. And you know, I should be able to, at the end of the year, be able to do this stuff on my own as well.
That is awesome news. The great part of it, not only that the surgery is done here, a salute to Dr. Song Bai Deng, who's now a part of our family, a part of our medical team, and of course to you, Dr. Scantlebury. But we really are thankful and happy for the result. That patient is doing well. More success stories to come. This is this is a story that we'll be sharing a bit more of as a testimonial when we have an interview with Dr. Scantlebury, with Dr. Song Bai Deng, and hopefully the patient as well will want to share how she feels now after that procedure is done, coming back into the clinic to have her checkups. These are the stories that we will be sharing with you, not only here at the Pulse Radio Show, but on our socials, on our website, and in traditional media as well. We have another caller on the phone line. We've been doing a lot of chatting about cardiology, but this is information that I know that the people really need to hear. Please, caller, turn off your radio if you're going to have this conversation with us. We really want to hear what you have to say. We really want to get your input as well. Thank you for calling the Pulse Radio Show. What's your question or comment?
Hi, good morning.
Hi, good morning.
Good morning. I'm a patient of Dr. Christy Paulette. 13 years ago, I had open heart surgery.
Wow.
Very good.
And Dr. Scantlebury, and want to say Malcolm and Carl. I also thank them.
Okay.
Chrissy, do you remember who the person is?
Well, this is not Chrisita is not here.
Oh, she's gone. Okay.
She's no. It was always Dr. Scantlebury. I mentioned Chrisita because she went to school with me. She was my classmate from first form right through to upper six. So I can't forget her. Right. You know, I always give her a bit of trouble.
And also Dr. Allan Smith.
Dr. Allan Smith.
Yeah.
Thank you so much for sharing that. We appreciate your call.
So Dr. Smith and Dr. Paulette are our cardiothoracic surgeons. So remember, I was talking about that bypass surgery or valve surgery, etc. They're the ones that cut open your chest and split the chest and work on the heart directly.
You see, my father's a doctor, right? He's a neurologist, though. But he always calls the surgeons the butchers. I mean, it is what they have to do, but you know what? They save lives.
They save lives.
They save lives, and that's what's important.
So, there are multiple approaches to dealing with disease, and some diseases require finesse and minor and minimally invasive procedures, microsurgery. Some require major surgery. This is why it's
open heart surgery.
Open heart surgery. That's what they do, and then we do minimal invasive procedures or surgeries. The interventionist, me and Dr. Lugo, and then there are patients who benefit from just medicine. There are patients who benefit from a pacemaker. So it's an entire team. You look at the entire heart. Your heart is a house, right? It's electrical wiring, the plumbing, the walls itself, and we're all technicians for that house.
And you all are doing some really good work. I really want to share my thanks to you and your team, and that's why I specifically asked you to mention them. I can't forget this one gentleman though. He's not actively in there because he has a whole other portfolio, a director of medical services, who's also a cardiothoracic surgeon. And he always he gets me involved by trying to give me the education so that I can share in this way, so that I can understand a bit more about these medical procedures, medicine in general, because Barbadians need to know what we are doing at the hospital to make sure that we are meeting the demand. Final thoughts, Dr. Scantlebury, as we go forward into a new year very soon. Independence is around the corner. People are enjoying their conkeys. I figure that they're relatively healthy. I eat a lot of them. But I eat them, when I say a lot is still in moderation. So final thoughts from you in terms of letting us see a turnaround in these trends as far as cardiovascular care.
So remember, we're a whole team. We as physicians are trying to deal with the type of cardiovascular disease that's already occurred, but you as the patient also has a role to play on this team, and part of your role is to help look after your body in the best way you can to reduce that cardiovascular disease burden. As you on a day-to-day basis, as you make those choices, make healthy choices, increase your physical activity. Don't put the sugar in the conky. The sweet potato and pumpkin has enough sugar. Don't put as much fat in it. What
about the raisins? We can get the raisins in there.
Please put the raisins in. I'm a raisin person. So make the healthy choice. If there is a choice of eating the sweet potato versus the mac and pie, eat the sweet potato. Eat the unprocessed food. Eat the stuff that's healthy. Your palate will thank you, and your waistline and your heart will thank you.
Indeed. Remember I told you that we had that notice from the medication delivery service. I can tell you, coming into that Christmas Eve and Christmas period, the medication delivery service will take a pause. So we will try to getting those deliveries before. So please, if you know that you're running out of your medication, we always tell you to give yourself a 7-day grace period before you run out, to make sure that you have that call in so that you can get that medication delivered to you. That number for you is 536-4808. 536-4808. Sometimes I doubt myself, so I always like to make a little double check. So you see what I mean? I gave you the wrong number this time. First time I can make mistakes. 536-4804. That's the number for the pharmacy department. And 536-4804, you can call that between 9 a.m. and 3 p.m. to place your order. Remember, if you have any other challenges, even a challenge with the medication delivery service, you can call 536-4800, 536-4800. That's our patient advice and liaison service. And of course, you can find all of the information you need, including this podcast, on our website. That's www.qehconnect.com. This podcast should be uploaded by Tuesday or Wednesday, and we'll keep you posted. It's all about keeping connected to you through the Pulse radio show, as we share with you what the pulse is at the Queen Elizabeth Hospital. A big thank you to you, Dr. Scantlebury.
Thank you.
She has to get back to her ground round, so you'll make sure that she gets there safely. It's all about the work that we're doing to deliver a better service to you, the public, on or as we celebrate our 60th anniversary. Could never leave that out. And as we go into the new year under a new strategy. Thank you for being a part of the radio show. I'm Shane Seeley, Communications Specialist with the QEH. We'll see you next week at this same time, 11 a.m. for another edition of the Pulse Radio Show.
The Pulse Radio Show brought to you with the compliments of MedSafe Medical Supplies Limited.
For all your medical supply needs, visit MedSafe Medical Supplies Limited. We offer a wide range of products including wheelchairs, walkers, canes, crutches, blood pressure machines, stethoscopes, and so much more. Conveniently located on Jemmets Lane, just a 2-minute walk from the Queen Elizabeth Hospital. And for your convenience, we deliver free to the QEH. Open Monday to Saturday, 8:30 a.m. to 5:30 p.m. Call us at 624-7542. MedSafe Medical Supplies Limited, your trusted source for medical essentials.